Hello, my name is Hildegard Peplau, and I am famous for the theory of interpersonal relations. A little bit about myself. I was born in 1909. I did obtain a bachelor's degree while studying psychological issues at Chestnut Lodge. While there, I worked with Harry Stack Sullivan, and I did base my nursing theory of interpersonal relations on Sullivan's theory, but I did fit it for the nursing field. Following that, I served as an Army Corps nurse, and then I created and taught the first classes for graduate nursing students at Teachers College. After that, I created the first graduate program for clinical specialists in psychiatric nursing at the College of Nursing at Rutgers University. Following that, I did spend some time working with the World Health Organization as an advisor. I was a consultant to the United States Surgeon General, the United States Air Force, and the National Institute of Mental Health. My theory is the theory of interpersonal relations. This is a middle-range descriptive classification theory. Mid-range theories are less abstract with relatively concrete concepts that address specific phenomena across nursing settings and specialties. Mid-range theories appear more applicable to practice and remain abstract enough to allow a wide range of empirical research. This nursing model includes 4 phases. There is an orientation phase, identification, exploitation, and resolution phases. During the orientation phase, this is where the problem is defined. It begins when the nurse meets the patient. This is where the type of service that is needed for the particular patient is identified. The patient tells the nurse what they may need, if they have any questions, if they share any expectations, or if they have preconceptions. This is kind of where the introduction is and where the nursing assessment is in addition to that. During the identification phase, this is where choosing appropriate measures needed by a professional is handled. Patients should begin to feel like they belong and should hopefully feel capable of dealing with the problem. This is basically when the nursing care plan is developed, and it's based on the situation and exactly what the patient needs, in addition to goals for the specific patient. During the exploitation phase, the nurse uses professional services based on the needs and interests of the patient. The patient should feel like a part of the healing process. They may also make minor requests or use attention-getting techniques. The nurse should be using interview techniques to explore, understand, and adequately deal with the underlying problem. This phase in the implementation of the nursing care plan and taking actions towards meeting the goals set in the identification phase. This is where most of the care is given for the patient. Finally, during the resolution phase, this is basically the termination phase, where the patient's needs have been met, they're well enough to go home or to wherever they reside. This is where the end of the professional relationship needs to end. This is also the evaluation of the nursing process, and we're evaluating whether the goals that were set have been met. Key terms of a theory. Every theory has key terms, including a person, environment, health and illness, and nursing. In the theory of interpersonal relations, the person includes the patient who is getting the care. The environment is the setting in which the nursing care is being developed. Maybe it's a hospital, maybe in current times it could be in the home, or whichever facility is necessary. Maybe a doctor's office and so forth. The health and illness is the patient's state of well-being. Nursing is the physical actions that are taken while caring for the patient. This could be giving medications, changing wound dressings, and anything that's needed to totally care for the patient. Within this theory, there are 4 steps that seem to follow. For the person, there's a patient and nurse relationship, which begins in the orientation phase, and it moves through the different stages of the nursing theory. In the environment, that's where the patient is getting treatment, such as the hospital. This is where the patient is getting cared in the identification and exploitation phases of my nursing theory. The health and illness aspect is the issues which are discovered in the identification process of my theory. Finally, nursing, which is the care provided during the exploitation phase of the theory. Now, there is a research study. The article is called The Theory of Interpersonal Relations Applied to the Preceptor-New Graduate Relationship. This article pretty much applies my theory of interpersonal relations to the preceptor and new graduate relationship. The article talks about the new graduate depending on the preceptor to teach them and to have good communication skills and to really help develop the new nurse. The article talks about the relationship between these two people, and it is likely to be more successful and lead to a lower turnover rate if the preceptor does have confidence and accepts the new grad. Now, there is a term, eating their young, where seasoned nurses eat the young nurses, so to speak. Instead of that, the goal is to form a trusting relationship between the two nurses, where the new graduate can reach out to the precepting nurse and they just have this relationship, and it does lead to a lower turnover rate within the facility, and it makes the new graduate nurse want to stay in a facility. Now, with this particular study, the orientation is when the new graduate meets the preceptor. The identification phase is pretty much where we're identifying skills of the new nurse and what they already know, what they need to be taught, and any problems that may have been an issue in their education and skill set. The third phase is exploitation, and that's basically teaching the teaching of the new nurse by the preceptor. This, in some cases, it may be allowing the new nurse to watch a skill and then the next time they do it themselves. Finally, in the resolution phase, that's pretty much evaluating the new nurse's abilities. It may be when the new nurse is ready to work on their own and the preceptor and new nurse relationship kind of ends and they become co-workers. There's also a case study. The theory of interpersonal relations can typically be applied to pretty much any nurse-patient scenario. Specifically during the orientation phase, once I had a newly admitted patient and just the phase was introducing myself and doing my first basic assessment on the patient. The identification phase is when we establish that the particular patient had a GI bleed, and the plan of care was developed and included finding the source of bleeding and controlling it and getting it to stop. The exploitation phase in this particular case is when myself and other staff and doctors work to find the cause of the bleed through tests like an endoscopy, a colonoscopy, the follow-through for the small bowel. And additionally, we tracked hemoglobin counts and we needed to administer blood products at one point. Finally, the resolution phase, this is where the labs were looking good, the hemoglobin started to come up, and we were confident that the bleeding had stopped and the patient was discharged. And those are my references. Have a good day.